Good afternoon, everybody. My name is Barry Hudson. I am the Director of Public Information, and we'd like to welcome you to the last press briefing for 2020. Joining us as always today, we have County Executive Mark Eldridge. We have Dr. Gales, our Health Officer, and we also have Dr. Stoddard, our Director of the Office of Emergency Management and Homeland Security, here to share our weekly information related to COVID. I'd like to remind all the reporters, if you'd like to record, please place your questions in the chat and indicate the news organization that you represent and the questions, who you want them directed to. So as always, we'll start off with County Executive Eldridge.
So good afternoon, everybody. I want to thank you for joining us again today. Hopefully we've been able to provide you a modicum of entertainment every week for the last 9 months. These are important opportunities to communicate with the public, and I'm glad you're here helping us do that. It's just a few days before New Year's and a few days after the Christmas holiday and the other holidays, and I've got to say this is really hard. On a personal level, my grandchildren are staying 3 blocks away, and I've seen them walk by the outside of my house. And on dinner for my granddaughter's birthday and for Christmas, we're held in separate houses with our pods, and being this close and not being able to get together is really hard, but it's also really, really important. My daughter had it, has recovered from it, had to sequester in her own house, and it's just hard watching how this all plays out. So I know that if you followed the advice that we have been providing, you had probably a less exciting Christmas than you normally are used to having. But that was really important. And as we go into New Year's, I'm somebody who's driven as far away as Pittsburgh to go to see a New Year's Eve concert with a favorite band, and I will not be doing that this year. My New Year's Eve will be in my house with the same pod that I've been associated with for the duration. And I hope that that many of you find a way to do that. Zoom or whatever it is with your friends who are farther away. I've done that too. But just make sure you stay safe. We are so close to really getting into vaccine world. Vaccines arrived. We've done, the beginning of the testing of the vaccinations with the limited supply we have. Or Dr. Gales and Dr. Stoddard will talk more about that. But it is real. It is here. It will be here in quantity as over the next few months. And I want to emphasize months, not days or weeks. And we're going to have to maintain everything we're doing today. But we have some certainty that when we get through the end of this, we will have a much greater return to a semblance of normal enough that we'll probably feel pretty happy about where we end up, even if it's not all the way back to normal as quick as we would like. So please be safe and be careful over the next couple of days. I know that some of you would love to talk about the lawsuit regarding indoor dining. I can't, same as last week, we're still in the process. The action we took was to protect public health by suspending indoor dining. As a result of the litigation, we're not going to be addressing questions about that issue. And I'll say that I've said this to you all a few times, pandemic has created some very difficult situations and required us to make difficult choices. There is no perfect choice here. There is no choice which is a win-win. And we recognize that we took a position early on that we were going to do everything we can do to protect people's lives and to keep people safe. And everybody knows this. This is not a Montgomery County issue. It is a national and international issue. That decision to maximize human safety, which is a decision that most people have made, has consequences for businesses. None of us are obtuse to the effect that it has on businesses. None of us think this is a good thing. I continue in every opportunity I get to lobby the federal folks who, at least in this county, are sympathetic to increasing, the funding and support for businesses and for individuals who need it because of the impacts of COVID. But that is where that kind of help has to come from. We'll continue to do what we can do. We're getting additional money from the state. We'll be rolling that out. But through all of this, our concern, front and center has been for public health, and public health is our guiding light, and it's going to continue to be that until we get to the end of the pandemic. So be patient with your questions. When the lawsuit's over with, we'll have plenty of answers for you and comment. But right now, not so much. Montgomery County, our actions do matter. And if we all do our part, we can make a collective difference. Today, our case count is 291. Yesterday, it was 410. I am always cautious about day-to-day changes in cases because we saw day-to-day changes before that went lower and lower and lower, and then it spiked back up. So a good day is a good day and a bad day is a bad day. 291 isn't good. 2-3 months ago, we would have considered 291 horrible. 291 just happens to be better than 410. Our test positivity rate is 7.2, and our cases per 100,000 are 39.1. Both of those numbers are multiples of what we had seen earlier back in the summer. So again, sometimes lower than it's been, but not low and still high. The volume of testing that's taking place at county-sponsored sites continues to be high. Last week, we tested 11,831 people, which was up from 10,778 people the week before. We expect the testing volumes to remain high this week and next week as the holiday season comes to an end. Vaccines were delivered to Montgomery County last week. We got our first shipment of vaccine. It's the Moderna vaccine, and Dr. Gales and his staff have received the vaccine. I will not be getting my vaccine until my place in the queue comes up. And I mean my place in terms of either age or vulnerability. I will not be getting a vaccine in my mind until we've vaccinated all the frontline workers and the healthcare workers. Any dose I get that takes away from those folks is a dose I don't want. I know how to stay safe. I can stay in my house. I can wear a mask, and I can do the things that'll keep me from getting infected. So until it's my actual turn, I will not be getting the vaccine. I was there at the Dennis Avenue Health Center to witness the vaccines and folks getting vaccinated, and it was really, really exciting to see that. The first group were, front-facing people. We were vaccinating the vaccinators, people who are going to have to go out and vaccinate people. So I was very happy to be a part of that. We are currently in priority group 1A, and that's a pretty large priority group. I forget the number, but it seemed like it was over 300,000. So we'll be working our way through that group. And the groups are set by the state of Maryland. And so we're following the guidance from the state in terms of vaccinations. This initial group includes the healthcare workers, first responders, and the long-term care facilities, both the residents and the staff. The vaccine remains in limited supply. Hospitals, as well as state and local jurisdictions, still have not received the amount of vaccine needed to vaccinate the number of healthcare professionals and frontline workers. And again, Dr. Gales will give you more about that as we go forward. Yesterday, I hope you noticed that Novavax, another Montgomery County company, announced the start of phase 3 trial for their COVID-19 vaccine. That will be taking place in the United States and Mexico. Makes them the 5th company to launch large-scale trial of coronavirus vaccine in the United States. And this is good news for the county and for our country. Just remind people it's important not to gather for New Year's celebrations. Please don't do it. Be as safe as you can be. with restaurants and other establishments largely closed, some people will be tempted to host gatherings in their homes and invite over friends and family. Again, don't do it. Next year, we'll be fine. If we need to celebrate New Year's in July, we can celebrate a New Year's party in July, but this is not the year to have New Year's party on New Year's Eve. Just not what we need to do. So please think about what you're doing before you act. And remember all those folks who we have lost or people who are sick. Because many of those who are sick are going to be suffering long-term consequences. We are still in a serious situation, and our actions really do matter. And if we all do our part, we can make a difference. If you look at where the county sits within the state, I have said before, it is not great. But on the other hand, we are toward the lower end of the curve on many of these things. And I think that has a lot to do with the steps that we took here. We were very protective from the beginning, and we're going to remain protective till we get to the end. There is that light at the tunnel, at the end of the tunnel. It is certainly there now, but we're not at the end of the tunnel yet. So don't confuse the light for being there. We know where we're going. We can see that this is going to change. We know there's light, but until you're there, you're not actually there. So we are where we are right now, and we're being patient. Keep masking up, maintain your distance of 6 feet, wash your hands frequently. And all these actions are really important to reduce the spread. And I just want to add that even the 6-foot guidance has been shown to be, too liberal. The fact is, the longer you're in a room with people, whether you're 6 feet apart or 10 feet apart, if you're in a closed room with people for prolonged periods of time, the distance becomes less important because you just get exposed to more viral particles if they're there in the room with you. The longer you're there, the more you're exposed, which is why we're really encouraging people not just to have a party and stay 6 feet apart, but pass on the party part, because that puts you in a room for prolonged periods of time. And we don't want you to be subjected to this. I also want to thank our county employees and the healthcare professionals and the frontline workers in the county and otherwise who have done so much and put yourself at risk through all of this. I give a special shout out to our own employees, because in the beginning, we didn't have proper personal protective equipment. The first masks we gave out, were the first things that were available, and they were not as good as they are now. We have folks who went and did their jobs every day. You see a fireman or a policeman out there. You see our county health workers. You see, building inspectors, people who are social workers working with populations that continue to need help and you could not pull help back from because of the coronavirus. Our people went out and did this work every day. So I especially want to thank them for being willing to do that and make sure that we did as much as we could to maintain some semblance of normalcy and a degree of support for people who really needed it. And I'm very appreciative of that, and I hope that the public is as well. And I really want to thank the people of Montgomery County for as much as you've done. I continue, when I drive around or if I have to go someplace, I don't see people without masks on. I have been in the grocery store a couple of times, and every time I've been there, every single person I saw had the mask on, and I haven't even seen the people who wear the mask but wear it below the nose. Everybody I saw had the mask above their nose and where it belonged. So people are listening, you're making a difference, and I'm looking forward to 2021. It can't help but be a much better year than 2020. We just have to make sure we don't stop now and make sure as many of us get to 2021 as we can possibly make possible. So with that, I'll turn it over to Dr. Gales.
Good afternoon, everyone. Thank you for the opportunity to be with you all, and I hope that the first part of your holiday season has gone well And as the county executive mentioned, that you have a happy new year later on this week. The first item that I'd like to discuss is, as you know, I did receive the first dose of the Moderna vaccine on last Wednesday, and I feel fine. I didn't grow 6 inches. My body didn't change. I wish I could have lost a few pounds as a result, but I didn't have any side effects that were reported. And I am looking forward to receiving the second dose of the vaccine in several weeks to come. The second thing I'd like to highlight is that the county executive did reference where we stand in terms of our COVID numbers. We are still seeing higher rates, although there have been some days where we've seen some fluctuations where the numbers have come down. We anticipate that we will continue to follow and monitor the trends as we move forward from the holidays, certainly expecting to see an increase in testing as a result of folks coming back from their holidays or potential activities. And we'll be particularly watching out to see where the case counts are following the New Year's weekend, as well to see if we do see a continued downward trend in those numbers. So again, we emphasize looking at the numbers with a sense of caution. The third thing I'd like to talk about briefly is the notion, going back to the first point about vaccination. As you know, Pfizer and Moderna have now had their emergency use authorizations approved. Pfizer had been distributing vaccines to our hospitals and our long-term care facilities. And as it currently stands, the Pfizer vaccine supplies that are being provided to Maryland will be dedicated to those entities. And we as a local health department do not expect to get any of the Pfizer doses for the foreseeable future. Now, last week, we did receive our first allotment of Moderna vaccines. Each of the health departments across the state received 100 doses. And this allowed us an opportunity to test out our systems and make sure our infrastructure was in place and ready to go. Now, this was a little different from what DC experienced. And again, recognizing DC is considered a state level health department and different from the allotments and how the vaccine doses were distributed in Virginia. So you may have seen some differences in terms of some of the health departments begin their process of providing vaccination to healthcare workers within their community. Now, we have received a second dose of vaccines on a local level. This time, it is a little bit more based around population, and this was allotment provided through the state. We received yesterday just over 4,000 doses from of Moderna vaccine that we hope to begin distributing as early as today. In fact, on last week, we did provide over 40 vaccinations to our first line vaccination team, who will be ultimately providing vaccines to the community. And we will continue today providing vaccines to individuals from that team, as well as our testing platform. Now, as we move forward, we also have a number of other clinics scheduled this week, and I would like to announce those now. And the team has already provided outreach to providers who answered our survey that we sent out a letter approximately 2 weeks ago. We received feedback from, I think, just over 700 different providers and offices across the county, totaling somewhere between 14 to 15,000 employees covered within those networks. And our expectation is that we will, the team again has already provided outreach to those groups. And we do have multiple clinics scheduled this week utilizing the allotment that we received on yesterday. Tomorrow, we have a clinic scheduled from 8 a.m. to 8 p.m. at the White Oak Rec Center, where we hope to and anticipate delivering approximately 1,000 doses of the Moderna vaccine. And we also have another set of clinics on Thursday with approximately 750 doses at our White Oak Rec Center and 750 doses to be distributed at our Public Safety Training Academy for our first responders. Now, we anticipate, and we have not received confirmation just yet, of what next week's doses will be. We do anticipate that it will be comparable to what we received this week, and we will begin setting up schedules for next week's clinics. We will have multiple venues. We're working to secure and continue one in the Down County area as one in the Up County area as well, to provide a place for individuals in category 1A to receive the vaccine. Now, you might ask, who's included in that? Now, there are ongoing conversations at the state level to provide further definition and clarification for the priority groups to break out so that folks at home understand where they fall in the queue, 1A, 1B, 1C, and so forth. And what we're focusing on right now are our emergency responders, our EMS team, the vaccinators who are actually going to be providing the vaccinations for other folks, the individuals who are involved in our testing sites, including testers and registration and administrative teams, our public health COVID response individuals, healthcare providers and staff members in urgent cares and primary care facilities, and in our dialysis centers. And this is consistent with what guidance we have received from the state to date related to those prioritizations. Now, we do recognize that I did throw out a number to say we had over 700 offices and providers respond. When we added those numbers up, that came to over 15,000 different workers and staff members. We do recognize that not everyone is going to get vaccinated overnight. And this will be an ongoing process. So we continue to open up clinics as we get our distribution and allotment. We can only allow as many spaces based upon the number of doses that we receive. And so more information will be put out as we get more firm details in terms of what our allotments will be, and we will be standing those clinics up very, very quickly. The last thing I'd like to mention, and I'm sure there'll be additional questions about what I just described, is folks have asked, well, when is it going to be my turn? Well, the short answer is we can tell you where you fit in terms of your category, but we don't have a hard and fast date when we will move from 1A to 1B to 1C to phase 2 and so forth. What I can tell you is we will be following carefully and trying to get as many people through the doors and through the queue to get vaccinated as quickly as possible. And so we will offer it to 1A, and if we notice that there is a decrease in the number of folks who are requesting appointments, we will move quickly to pivot to say the next group to come in, again, to try to get as many people through the doors as we can based upon the guidance and guidelines that have been provided from ACIP, the CDC, and the state level. So we appreciate your patience, and we are working to be able to serve and make these resources available to our community residents. Thank you, and happy to answer any questions you may have.
Good afternoon. I know there's going to be lots of questions about vaccination, so I'll make my update brief today. Over the weekend, we had teams out doing enforcement related to both the governor and the county executive's orders, both in outdoor dining, particularly looking at the tent issues, and in our retail spaces and other establishments as well. On the tent front, we are looking to update our guidance on tents. We've obviously gotten a lot of questions. Some of the issues with tents are obviously COVID related, but many more of them are related to fire code issues that Department of Permitting Services is updating their guidance to cover more adequately. So you can expect to see that updated guidance coming out over the next few days, just to clarify and answer some of the many frequently asked questions that we get as it relates to tents. We did not issue any citations or formal warnings. We did do a lot of education over the weekend, particularly on the tent issue, but on other issues as well. We are training teams from our Animal Services Division as well as Department of Housing and Community Affairs. Training is tomorrow. We have one scheduled for next week, so we'll be increasing both our education and our enforcement components in addition to focusing more on retail and other places now that indoor dining is currently suspended. On the letter of approval front, I know we got a lot of inquiries about this. We did receive 26 big box store exemption requests through letters of approval. We granted 25 of those. The one that we did not grant was actually an increase in capacity request beyond what their square footage would allow. They were seeking to go from, one for 200 square feet, which is our rule, would have allowed them to have 63. They're actually asking to go beyond that 63 up to 150. That would have actually violated the 50% requirement of the state in addition to our local orders, so that request was denied. They were left at the one for 200 square foot that everyone else is frankly operating at now. Obviously, we have some large retailers, and so we went through their strategies and plans to make sure that we had, we felt comfortable with what they were proposing or attempting to implement. And we will hold them accountable to those plans as we move forward through our enforcement and education process. One of the benefits of going through this letter of approval process is not only that we get to see those plans and we can hold them accountable to those plans, But should we find that there are large retailers who are either incapable of or unwilling to follow the letter of their own planning processes, we can simply rescind the letter of approval that has been granted to them, and that will restrict them to 150 customers and workers in a store. And so obviously it gives us an additional ability to do enforcement. We want to work with the businesses and have been this, throughout this process, to try and allow as much safe activity as we possibly can, particularly in our retail spaces where, face coverings can be worn all the time. But obviously we're not going to allow for unsafe conditions to proceed. I think that's all I wanted to cover today. I think we can go into questions.
Okay, thank you. And remember, if you have questions for the media, please make sure you indicate your news organization and who you want to direct your question to. Today, Chris Gordon must not be here because the first question is from Rebecca from the Washington Post, and she directs her questions to Dr. Gales.
Oh, great. Finally in first place after a year of being behind Chris. My question is for Dr. Gales and for Dr. Stoddard. Do you expect, given that we've seen sort of record levels of air travel this past week, do you expect cases in Montgomery County to surge again in January? And if so, do you think the county has the infrastructure and the capacity to handle both vaccine distribution and another, God forbid, surge in cases?
Well, I do think it is concerning that we did see record levels of travel through our airports being reported throughout the pandemic, particularly given the higher levels of community transmission where we sit right now. And again, it's important to emphasize is that, yes, the travel component is important, but really what is it that people are doing when they land in their destinations or they get to where they're going? And I think that's the biggest piece that is the unknown factor. And hopefully that with the advice that has been provided repeatedly from different outlets, that people, if they did travel, they did adhere to, wearing face coverings and, practicing physical distancing and those types of practices to mitigate any potential risk of transmission. But at the same time, again, given the high levels of community transmission where we sit right now going into the holiday, we actually are at higher levels now than where we were before Thanksgiving. We are concerned and are on alarm and going to continue to follow to see if those numbers bear out. Now, as it relates to surge capacity, again, our hospitals have their playbooks in place. And they've continued to, look at ways to grow and expand their capacity. The physical blueprint, we do have a significant amount of space, but one of the concerns that we continue to monitor, as well as other jurisdictions, is the ability to staff those beds and have adequate staffing and appropriately trained staffing to be able to provide the response across the level. I'm confident in our ability to manage that and do that, but again, certainly all of this is concerning, and reasons why we're continuing to follow the trends on a routine basis.
I would only add to answer that question a little bit too. Number one, some of the publicly available data, and again, we have no direct information on this, suggests that maybe travel out of BWI and perhaps some of the other hospitals in the region may have been a bit better than what the national numbers suggest. Number one. Number two, some of the aggressive actions that were taken by the county executive and county council to limit indoor dining and other activities, we believe may offset some of the increase that we may potentially see after the holidays. And even in the modeling data that Johns Hopkins has provided to us, the most recent update that we had right before Christmas had suggested that the actions that were taken in early November to curb some of the capacity numbers, both at state and local levels, did have some impact. That it was partially masked by the increase that we saw by the Thanksgiving Day travel, but some of that, some of the additional actions that were taken may have blunted just how high that peak went. And so I'm not saying that's a good thing, but it does give some credence to the probability that the actions that have been taken both in Montgomery County and neighboring jurisdictions may help to reduce some of the surge that we are going to see. But candidly, I think we're all waiting a little bit with bated breath to see what happens in terms of our testing numbers over the next couple weeks. I mean, I would expect that we're going to see some unusual numbers this week just because of the testing irregularities in terms of, you know, days where testing is markedly down because of holidays. And then those, bookmarked or bookended by days of high testing because people are trying to get tested before they do activities. And so I think we're sort of waiting to see what happens, but we have some reason to think that some of the actions may curb some of the spread and other reasons to believe that, you know, given the travel levels, that we could see significant surges. So.
Got it. Thank you.
Our next question is from Kate Ryan, WTOP, and she has questions for the county executive and for Dr. Gales.
Thank you very much. County Executive, I know you're not going to talk specifically about the court case, but in terms of those who argue, you know, there were these projections of we would have X amount of cases by a certain point in time, and look, we don't have that. Then why do you have to have these continued restrictions? Can you talk to that argument?
I don't think I can talk to arguments that we're going to make and respond to in court. And anybody who did projections, I mean, if you ever looked at the Hopkins projections, you would see ranges, and ranges depended on behaviors. And so, you know, I will say, you know, back in the summer, when our cases were down and people are saying, look, your numbers are so low, you know, why don't you just open up? And it was like, they're low today. There's a lot of evidence they're not going to be low a month from now. Mm-hmm. And sure enough, they weren't low a month later. So things change over time. And what looks good in the moment isn't necessarily a predictor of what the number is going to be a week later or a month later. That's why you don't hear me dancing around every time we got a good number and say, oh, look how great this is. Those things can change in 24 hours. And
got it.
That's what we're dealing with. There's, you know, not absolute certainty.
Got it. Dr. Stoddard, can I follow up with you on hospital capacity? We've seen, for example, in some areas like Western Maryland, where there is not a lot of hospital availability, are we still seeing folks having to be transferred locally? And again, are we in a position to stand up more quickly should we see a post-holiday surge?
I certainly think Dr. Gales may be in a better place to answer some of this, but certainly the state rules around transfer of patients did significantly allow for additional transfers to occur. And we have every reason to believe that those transfers are occurring every day throughout the pandemic, and will continue for a period of time to allow for that balancing out of patients where possible. We do have surge capacity in the hospitals, and I know that the hospitals were required by the state to provide plans to increase that surge capacity. And so there are strategies that will allow us to expand beds to an extent, while recognizing that a bed that you expand into that was not intended to be an acute care or an ICU bed that you just create as an ICU bed overnight will not necessarily be the same quality as the acute care bed or ICU bed that we exist in under normal circumstances. I think, though, not all beds are created equal, and frankly, staffing is a big part of that. You cannot conjure ICU nurses and acute care physicians out of thin air. And so the hospitals can do some interesting tricks around cancellation of elected procedures. And I use that term very loosely because if you're the person getting a heart transplant, you don't really view your surgery as being that elective, but by the definition it is. And so there are things that can be done to increase capacity, but once you start to do that, and as they're seeing right now in Los Angeles County specifically, you get into some really dangerous territory around rationing of care and who gets what quality of equipment and who doesn't. And that's there is space, but you can't just keep adding on more and more and expecting that to hold up. Dr. Gales, I don't know if you have more to add to that.
I just add to the two questions. The first from the county executive, we are, as he mentioned, we have an ongoing lawsuit. But what I would say is that the case rates where we have now are higher than where we were in the spring. and the percentage of acute care beds and acute care beds in use in the hospitals is higher than at any point we have seen in the pandemic to date. So just to put those facts out there to shape that question. And to the answer that Dr. Stoddard gave, I would just add that what your question, Kate, actually encapsulates part of the concern that we have right now, which is different from where we were in the early stages of the pandemic. If you recall back then, the larger population centers in Maryland were hit significantly harder than some of the other places. And so there was area to kind of absorb some of that shock to the hospital system in those smaller areas that you referenced, not only in terms of space, but also in terms of being able to recruit staff to be able to support the types of care that are needed in those facilities. To your point now, those smaller areas are also hit hard by the impact of COVID. And so we don't have as many resources available to be able to provide support as everybody's being impacted. But I do feel confident again that the hospitals who work deftly and nimbly throughout the pandemic will continue to implement the strategies that they have. But to Dr. Stoddard's point, at some point you can only create so many beds. You can only have a finite amount of resources, and we certainly don't want to see ourselves in a position such as other jurisdictions have experienced across the country, where they have run out of room, and you are in situations where you indirectly are rationing care based upon the limited resources that are available.
Got it. Thank you.
And we have a question from Brianna from Bethesda Beat, and her question is for Dr. Gales. Brianna?
Okay, sorry, I had trouble unmuting myself. So I have a few questions for Dr. Gales. First, just kind of jumping off of Kate's question, can you provide an update on hospital capacity as far as if any hospitals are at full capacity for ICU or acute care this week? And the 4,000 doses that the county expects to receive as early as today, is there a sign-up process for medical providers, or how exactly are you all coordinating with them to get people vaccinated? And then I have one follow-up question.
Okay, all right. Well, hopefully I'll go through these first two quickly to get to the third. So the first question that you mentioned, I don't have the specific hospitals that are at capacity, but based upon our surveillance report yesterday afternoon, we did have 2 hospitals that had no ICU vacancies. And it's important to talk about that, and I apologize for not clarifying this before. In terms of when we're saying vacancies, that means that they may have beds, but not necessarily the staff to be able to support them. And as of yesterday, there were 2 hospitals with no ICU vacancies, and there were 15 available staffed beds available in the ICU units. And as it relates to acute care beds, there were 149 available staffed beds across the hospital systems, and 1 hospital reported having no vacancies from a staff perspective. Again, I don't have the specific information, but that was our surveillance report as of yesterday afternoon. Now, as it relates to the vaccine process, to kind of walk everybody back through the process and how this is going to go. There is an electronic surveillance and scheduling system called PrepMod, within which individuals are able to go in and schedule their appointments, as well as complete the consent process that is a part of the registration process. I went through this process on last week to test it out, and the team is continuing to work to refine. But the way it will work is that providers will have access to a link to be able to go online, schedule their appointment, complete the registration. And so when they come in to get their appointment, we will be asking folks to have confirmation or proof of their licensure and their employment to confirm that they do fit the criteria for 1A categorization. But the expectation is that process will be completed. The wait time will be minimal. They'll come in and get their vaccine, and we will observe them for approximately 15 minutes to make sure they don't have any signs of any type of allergic reaction. But the way the process is working is, again, that information, the team is sending that out to individuals who provided a response to the survey, and we will be sending that information out broadly later on this afternoon so that providers who may not have completed the survey will be able to go online and schedule appointments. We do recognize that there is a situation where we'd love to be in a situation where we run out of slots available. And we're hoping to make, again, 1,000 slots available tomorrow and 1,500 slots available split between the two different locations on Thursday. And certainly next week, we will be utilizing any remaining supply from this week and hopefully a new set of supply from the state on next week to stand up additional clinics to be able to get folks in who may not have been able to access this week's clinics.
Great, thank you. And my last question is, I know you addressed concerns over any potential case surge because of Christmas and travel. Is there a positivity rate or some other measure that county officials have determined could potentially trigger a stay-at-home order if it reaches a certain level?
I think we continue to use the measures and metrics we have so far, including the test positivity, the case rate. Those have been the two that have been used most consistently at the local, the regional, and the state level. We again also would be looking at those secondary factors, such as hospital utilization, the amount of folks who are showing up to the emergency room requiring care, and also if there's any alarming information that comes out of our contact tracing apparatus that demonstrates that there are particular activities that carry significant weight or increased risk in terms of transmission.
Great, thank you so much.
Okay, I don't see any more questions in the chat. So as always, going once, going twice, going 3 times. Well, thank you very much for
the question.
Oh, Kevin Lewis has one. Sorry. Hi, Kevin.
Hey, sorry.
Who's your question directed to?
In my quick attempt to get the question answered. This is just a question for County Executive Elrich. Wanted to just ask about the ferry service and everything that broke yesterday with concerns for folks on the Virginia and Maryland side that use that service, whether daily or just intermittently.
Yeah, I mean, we're concerned about it. Loudoun County's concerned about it. The county over there was quick to make a note that this wasn't any action that they took and wasn't their idea. So we're hoping that that these parties can resolve it. I mean, it's a dispute between the landowner on the Virginia side and the ferry. And the ferry obviously needs access to the landowner's property. The Montgomery County has no jurisdiction over that landholder. But both us and Loudoun County have an interest in making sure this link is continued. So we're continuing to watch and see how this plays out. But this is, no, this was not we were not alerted to any of this when it happened. So this in real time. So we're playing catch up and trying to figure out with our jurisdiction across the river, how do we deal with this?
Would it be fair to say your hope is that service will be restored?
Yeah, I think, it's been there for a very, very long time. And so they've got to find a way to resolve this because a lot of people depend on it. And I'm hopeful that they'll be able to resolve it. Obviously, the ferry service had happily been in business for quite a while. And the other party was in a relationship they thought worth having. And I guess they've got to resolve what their differences are now.
All right, thank you very much.
Mm-hmm.
That's the last of our questions from the media. I want to thank you all for joining us and give you the same reminder I have for the last couple of weeks. Hopefully that you will report either through your reporting or post on your websites ways to support our local restaurants, and go to Visit Montgomery and look up MoCo Eats for places for people to dine at home during this holiday season, as well as the Moco Marketplace is another location. We'd like to thank each of you as the year ends for your partnership in helping us get the word out about the things that are going on in Montgomery County. And we look forward to working with you going into 2021, which let's hope will be a much better year. And we'll actually be able to do face-to-face press conferences, maybe with face masks, but hopefully face-to-face. And you all be safe, and Happy New Year in advance. Thank you very much.
Thank you.